What do you do if you have carpal tunnel issues? Carpal tunnel is a nerve that runs along the forearms here, and when people type a lot or their forearms get really tight, that's when this starts to bother them. You go to Western doctors, and a lot of time what they'll offer you is cortisone shot and eventually surgery. For certain people, that is what their only option. But if you would like and want to try something different and see if it fits your body, it's a very simple stretch. The trick is not to do 100% and not even to do 80%. The trick is to do 40% effort. So the stretch is very simple. It's stretching the wrist this way, but with a 40% effort. So you'll back off. So if you can do it here, you back off to here. So what you want to do is make sure that you follow two rules. The first rule is make sure the middle finger points down. There's a tendency to put the middle finger sideways. And the second rule, you want to have the root of the palm touching the surface that you're stretching, if it's the wall or the door. And if you feel that it's really an effort to get the root of the palm to the wall, that means you're doing 100%. So 80% should feel light and easy, and you still want to back up from the 80% to 60 and 40%. And it's not so much what you feel. You're not going to feel a big stretch, because we're trying to stretch the fascia first and the skin, and then secondary is the muscle, and then the tendons. So it's more, you got to put the timer for a minute or 2 minutes, hold it, and then move to the other side just to balance or prevent, and then do it a few times a day. And if it inflames, you know you did too much. And if it gets better, you know you're on the right track. After a while, once you finish doing this, if you want to add one more stretch, you want to do the pretzel. So the pretzel is grabbing both hands this way, and then using the wall to support the elbow. So grabbing both hands and then using the wall for supporting the elbow. If you cannot reach your hands behind your back, what you do is you take a scarf, a belt, or a towel, and you roll it, and you put it behind you, and you grab this way. And you go to the wall, and you do it this way. So you want to use the hands that the elbow that is up, you want to use it on the wall, like that. So that makes it passive, and also the hands in the back, they pull gently, and then you stretch some more of the forearms, and that get rid of the pressure on the nerves and the carpal tunnel problem.